Dr. Deuk here at the Deuk Spine Institute. We have a patient who traveled from Canada. And I was joking with him yesterday. I asked him to speak French during surgery, but I know he can't speak French. At least I think he can't, because he comes from the west coast of Canada, over in Vancouver. Vancouver Island is what I've learned. Beautiful place. I've been to Vancouver a couple of times. So you came here to Deuk Spine Institute in Florida because you're having back pain and leg pain in both your legs. We did a video conference and I reviewed your MRI scan. And in the end, you felt comfortable enough to come here and have your back treated with the Deuk laser disc repair. Now, how do you feel today?
Today I feel great. Yeah.
All right, so it's one day after your surgery, less than one day.
I felt great as soon as I went out to the car.
So yesterday, as soon as you left, you felt good. You could feel a difference.
Well, there was 100% difference. There was no leg pain anymore at all. Discomfort, none of it was gone.
Yeah. So he had 3 discs that were damaged, L3-4, L4-5, L5-S1, and the nerves were being irritated by the herniations and bulges. And he had back pain as well. We confirmed the back pain was coming from the disc during his surgery, and we did the laser surgery, and here he is less than 24 hours later. How long have you lived with this back and leg pain?
It started about 10 years ago, and steadily has gotten worse. Tried chiropractor, physio, all the different alternative meds. Some medications when it got bad, absolutely. Mm-hmm. And early on, the treatments would help for up to a week at a time, and more recently, I would get maybe a day's relief, and then I was right back to walk. And my friends told me I looked like I was about 90 years old walking around.
So the pain in your back and legs clearly had an effect on your life, your quality of life.
Absolutely, it did, yeah.
And what other treatments were offered to you surgically in Canada?
They talked about, and I won't know what it's called, but on your models, it shows all the steel and stuff they put in. What's that called?
Decompression and fusion, probably.
Fusion, yeah. But they also said they wouldn't do that for me until I was much older because I was too young. So the best they would offer me is pain management, to go to a clinic and get something shot in there into my back, and I wasn't comfortable doing that.
Yeah, it's a common thing we hear from patients around the world, is that their surgeons are very reluctant to treat them until they're basically crippled.
Yeah.
And so would you want to wait till you're crippled to be treated?
No.
Yeah. So the problem with waiting till you're crippled to be treated and in a wheelchair is that it could take a couple of years. That means you have to suffer even more for a couple of years. And obviously, if you're in a wheelchair, you've gotten worse than you were before you were in a wheelchair. So basically, your quality of life isn't just going to be bad for a few more years till you get in a wheelchair, but it's actually going to go downhill and get even worse. And then by the time you're in a wheelchair, you've lost even more strength and muscle mass in your legs because the nerves are being pinched for a long time. And basically, it comes to a situation where you really can't reverse or change and get back the strength and feeling in your legs because the nerve damage is so severe. So why surgeons say this? This is an old-fashioned way of thinking about back problems. It comes from a generation of surgeons that are really older and leaders now, sort of in the field, but they're teaching the younger groups the wrong things, because what they believe was back surgery should be the absolute last resort when you're basically going paralyzed. And you know, if you are able to fix backs like we do here at Deuk Spine, you don't have to tell patients to wait till they're paralyzed. You can fix it right now and maintain their quality of life and preserve the quality of life and get them back to normal. So would you say your pain is now cured?
I would say it's now cured.
Yep.
And I'd also like to add that it's one of those situations, when I first looked at it, it seemed too good to be true, so you kind of question it. I was lucky enough to have a referral from Canada of someone who had been here before, which helped me through that process. It's not too good to be true, it's absolutely true.
Well, I appreciate you saying that, because I try to help people online, people I don't know, people I see that are suffering horribly with pain. And I tell them you don't have to, suffer anymore. You can come here, we can help you, we can get rid of the pain. And they commonly think that I'm you know, exaggerating the results, which I'm not. Because,
You're not.
yeah, virtually 100% of our patients have 100% relief. So, well, I appreciate you sharing your story. Is there anything else you want to say to our viewers before you go back to Canada?
Well, I tried to convince Dr. Deuk here that he's a celebrity, and he declined that notion, but he absolutely is to me. And I'm so
appreciate
thankful.
that. Thank you so
Thanks.
much. Glad you're here, and I'm excited for you.
I'm excited too.
All right, let's get you out of here.